Okay, I'm going to continue the lecture series with Chapter 19, and we'll talk about some disorders that are associated with the immune system. Infection and immunosuppression are basically failures in the immune system. There are superantigens that cause a release of cytokines that cause adverse host response, and we talked about cytokines when we talked about the immune system. Allergies and transplant rejections are basically harmful to immune reactions. Antigens such as Staphylococcus enterotoxins, these are referred to as superantigens. They indiscriminately will activate T cells, and once that happens, it causes a very harmful immune response. The term hypersensitivity or allergy refers to sensitivities beyond what is considered normal. It occurs in people who have previously been synthesized by exposures to an antigen called in context an allergen. Once synthesized, another exposure to the antigen will trigger an immune response that will damage host tissue. There are four principal types of hypersensitivity reaction, and you should be familiar with these reactions. Again, hypersensitivity reactions, responses to antigens or allergens that lead to damage to host tissue. And again, it requires a synthesizing dose. Type 1 reactions are anaphylaxis reactions. Anaphylaxis comes from the Greek word against and protection. These reactions result in a combining of antigens with IgE antibodies. They may be a systemic, producing something fatal such as shock and breathing difficulties, or localized such as hay fever, asthma, and or hives. IgE antibodies bind to the surface of mast cells and basophils. Mast cells are prevalent in the connective tissue in the skin and the respiratory tract and surrounding blood vessels. Basophils circulate in the blood. When the antigen combines with an antigen combining site at two adjacent IgE antibodies and bridges the space between them, mast cells or basophils undergo what's called degranulation, or the releasing of chemicals called mediators. The best known mediator is histamine. It affects blood vessels, causing edema or swelling, erythema, causing redness, increased mucus secretion, and smooth muscle contractions resulting in breathing difficulty. Now again, think slowly of this process. With the release of histamines, we see its effect on blood pressure, on blood vessels. This causes edema or swelling. It causes erythema, redness, increased mucus secretion. This mucus is going to go in the airway, in the bronchial tube. You see smooth muscle contraction, which means now not only is there fluid in the bronchial tube, which takes up space, but now there's not enough space because the smooth muscles will contract, thus narrowing the bronchial tubes. So now you have a tightly contracted bronchial tube that's filled with fluid, and there's no room for air. This is what results in difficulty breathing. Other mediators known as leukotrienes, these tend to cause contractions such as spasms in asthmatic attacks, and prostaglandins, which tend to cause increased secretion of mucus. Collectively, mediators attract neutrophils and eosinophils to the site and cause inflammatory symptoms. Again, a review of type 1 anaphylactic reaction. It involves IgE antibodies, localized or hives or asthma from contact with inhaled antigens, or it can be a systemic response, in essence where the individual will suffer from shock from ingesting or injected particular antigens. When an individual is sensitized to an injected antigen, such as an insect sting or penicillin, receives a subsequent injection, the release of mediators can result in a drop in blood pressure. This is referred to as shock. This is when the blood vessels throughout the body vasodilate. When they dilate, large blood vessel has little pressure, and so the person will go into shock. And that can be fatal, even in a few minutes. The term systemic anaphylaxis or anaphylactic shock. The injection of epinephrine, which is used to treat anaphylactic shock, and we see it also used to treat severe asthma. You can have a localized anaphylaxis, usually associated with antigens that are ingested or inhaled rather than injected. Examples are like hay fever, for which we can use an antihistamine drug to treat the symptoms. It can sometimes be difficult to distinguish between food hypersensitivity and food intolerance. If contact with an allergen cannot be avoided, a desensitization might be attempted. This consists of a series of injections. Small dosages of an antigen are given to the host. The idea is to induce IgG antibodies to serve as a blocking antibody that intercepts or neutralizes the antigen before they can react with the cell-bound IgE antibody. Immunological injury resulting from type 2 reaction is caused by antibodies that are directed at antigens on the host blood cells or tissues. The host cell plasma membrane may be damaged by antibody and complement, or macrophages may attack the antibody-coated cells. Transfusion reactions such as those in ABO and Rh blood group systems are this type of reaction. Type 2 cytotoxic reaction. It involves IgG and IgM antibodies and complements. Complement activation causes cell lysis and damage to the macrophages. Human blood in group of 4 principal types: A, B, AF, and O. Or I'm sorry, A, B, and O. Is a classification called the ABO blood group. Sorry for the typo. People with type A, for example, have antigens designated by A on their red blood cells. People with blood type O lack an A and a B surface antigen. In both, about 80% of the populations called secretors, antigens of the ABO blood appear in the saliva, semen, and in bodily fluids. Again, these are the blood types: type AB, B, A, and type O. Now, the antigens that are on the blood cells, we see A and B, we see B, we see A, and on O we have no antigens. Roughly 85% of the human population has an antigen named Rh factor, and they are called Rh positive. If blood from a Rh positive donor is given to an Rh negative recipient, the production of anti-Rh antibodies will be stimulated. If an Rh negative person receives a transfusion from an Rh positive blood, then there will be a reaction. If an Rh negative female and an Rh positive male produce a child that is Rh positive and synthesize the mother at birth, if the fetus in a later pregnancy is Rh positive, the antibodies developed in the mother may attack the fetal red blood cells. This results in a hemolytic disease of the newborn called erythroblastosis fetalis. This can be prevented by passive immunization of an anti-Rh antibody or even replacement transfusion of the fetus blood. There's another condition referred to as thrombocytopenia purpura. This occurs when blood platelets, which are essential for clotting, are coated with drug molecules that function as a hapten. If antibodies developed against these haptens, it causes destruction of platelets. A disease condition may result. In hemolytic anemia, the body may form antibodies against its own red blood cells. Immune-caused destruction of white blood cells is referred to as agranulocytosis. Immune complexes form when certain ratios of antigen and antibody occur. When there is a slight excess in the antigen, the soluble complexes that form the small and escape as phagocytosis. Circulating immune complexes in the blood may locate the basement membrane beneath the endothelial cells of the blood vessels. This can set up an inflammatory tissue-damaging reaction. Glomerulonephritis is an immune complex condition that causes inflammation or inflammatory damage to the kidney and the glomeruli. IgG antibodies and antigens form complexes that lodge in the basement membrane. Now, up to this point of the discussion, hypersensitivity has involved IgE, IgG, and IgM. Type 4 reactions involve cell-mediated immune responses, because mainly by T cells, but sometimes by macrophages. These reactions are often not apparent for the day or more. This is called a delayed hypersensitivity reaction, during which time the precipitating cells migrate to and accumulate near foreign agents. Now, usually type 4 reactions, the foreign antigens are phagocytized by macrophages and then presented to the receptors on the T cell surface. The T cells are primarily cells that may include T cells. The principal factor is the release of lymphokines from T cells reacting with target antigens. So again, the T cells that are primarily cytotoxic T cells may include the T cells from these types of reactions. Delayed type of hypersensitivity reactions are due to these types of cells. Cytokines attract macrophages, which initiate tissue damage. Skin test for tuberculosis is a synthesized individual to protein components of tuberculosis bacteria that's injected into the skin. A day or two is required for the reaction to appear. Cases of allergic dermatitis or allergic contact dermatitis are usually caused by a hapten that combines with proteins in the skin. Typical foreign reagents or antigens are poison ivy, cosmetics, latex, metals such as nickel, and jewelry. The patch test is which a sample of suspected material is taken to the skin, which will determine the offending environmental factor. Now, in autoimmune disease, this is when individuals will lose the immunological self-tolerance. In our discussion of different types of hypersensitivity reactions, we have mentioned several autoimmune diseases. These occur when there is a loss of self-tolerance, the immune system's ability to discriminate between oneself and one's non-self. It is believed that some clones of lymphocytes, or forbidden clones, having the potential to respond to a self-antigen may be produced during fetal life, but are destroyed or inactivated. Clonal deletion during fetal development ensures self-tolerance. Autoimmunity is the loss, again, of self-tolerance. A type 2 cytotoxic autoimmune reaction. Myasthenia gravis is a disease in which autoantibodies coat the acetylcholine receptor junction, preventing nerve impulses from reacting to the muscle. In Graves' disease, autoantibodies attach on receptors of the thyroid gland, and it causes an excessive production of thyroid-stimulating hormone. Type 3 immune complex autoimmune reaction. This is an example that we see with systemic lupus erythematosus. This is a systemic autoimmune disease in which individuals produce antibodies directed at a component of their own cells, including the DNA. Immune complexes damage the kidney and glomeruli. In rheumatoid arthritis, this is a result of immune complexes that are deposited in the joints. Immune complexes called rheumatoid factor may be formed by the IgM immunoglobulin binding to the Fc region of the normal immunoglobulin. Chronic inflammation causes joint damage. Multiple sclerosis is a neurological disease which has T cells and macrophages that attack the myelin sheath on nerves. In Hashimoto's thyroiditis, this is a result of destruction of T cells, primarily T cells. In insulin-dependent diabetes mellitus, this is caused by immunological destruction of the insulin-secreting cells of the pancreas by the self-mediated immune system. Just as a review, again, type 1 reactions, these are due to antibodies against the pathogen. Type 2, antibodies react with cell surface antigen. Type 3, immune complex, IgM, IgG, complement and immune complexes deposited in tissue. And type 4 is mediated T cells. The human leukocyte antigen complex is an important concept that I want you to be able to understand. These reactions are related to the human leukocyte antigen complex. One of the inherited genetic characteristics or differences is histocompatibility antigens on the cell surface. We all have this. Genes controlling these antigens are major histocompatibility complex antigens. In humans, these genes are also called human leukocyte antigen, or HLA complex. Histocompatibility antigens. These are self-antigens on the cell surface. This is how we're able to determine that our own cells are self, or if cells are foreign. Major histocompatibility complexes are MHC. These are genes encoding for histocompatibility antigens. In human leukocyte antigens, or HLA complex, these are major histocompatibility genes in humans. Now, for successful transplant surgery, tissue typing has to be used to match the donor with the recipient. Now, if you match class 1 antigens, these are HLA-A, B, or C, it's long been a standard procedure of matching for class 2 antigens, HLA-A, which is also represented by DR, DP, and DQ, might be more important. The donor and the recipient must have the same ABO blood type. I think that's a given. If the correct HLA typing has not been done, then transplants from different organ systems may not match to the recipient, and thus our immune system will not recognize the HLA typing, and then our immune system would attack the transplanted organ. The cornea and the brain are examples of privileged sites where antibodies do not circulate into these regions. Privileged tissues, such as a pig heart valve, is not antigenic, and it does not stimulate an immune response. A development that also promises to transform transplantation medicine is using stem cells. These are pluripotent. In other words, what this means is that they can generate cell types such as nerves, bloods, or other cells. Stem cells are basically a blank sheet of paper, and they will develop into the type of tissue irregardless of its function. Stem cells can then convert into those types of cells. Stem cells first appeared in embryo in embryonic stem cells. In principle, they could be cultured indefinitely, generate useful amounts of any other tissue for transplantation. As the fetus develops, embryonic stem cells become fetal stem cells and later then become adult stem cells. Blood forming or hematopoietic stem cells in the bone marrow produce red blood cells, platelets, white blood cells that are essential for the immune system. These hematopoietic stem cells are important for transplantation, again because they produce all of the cell lines. Obviously, there's ethical consideration when we're using embryonic stem cells. Most of you are familiar with the debate that goes on about stem cells on a regular basis. It would be desirable if adult stem cells are present only in a small amount of number and they grow at poor rates, could be used to generate transplantation tissue instead of embryonic stem cells. But unfortunately, it's the embryonic stem cells that are able to differentiate so rapidly and so well. The eventual goal is to work stem cells into therapeutic cloning. This is genetic material of a patient with a disease would be used to create stem cell lines that can be used to treat that disease. This would avoid almost any rejection problem. Transplants may be attacked by T cells, macrophages, complement-fixing antibodies. Transplants to privileged sites do not cause an immune response, as I said earlier. Stem cells may allow therapeutic cloning to avoid rejection. The transfer of tissue, such as skin, from one part of an individual to another on the same individual is referred to as an autograft. Now again, HLA typing would be the same because you're transferring tissue from one part of the body to another, so there should be major histocompatibility here. An isograft are transplants between identical twins. Again, obviously the blood typing is going to be similar, but recognize that the number of antigens that each of these individuals have been exposed to may be a bit different. Such transplants typically, though, are not rejected because of the similarity in the identical twins. Allograft transports between related people represents most transplants that we see today. There's also xenotransplantation products, which were formerly known as xenografts. These are transplants of tissues from animals other than humans that tend to be strongly rejected. Xenotransplants and, under some condition, human-to-human transplants are subject to hyperacute rejection because antibodies that the human develop early in infancy against distantly related animals such as pigs. Antibodies and complements will destroy xenografts within hours. When bone marrow is transplanted to people, the transplanted tissue may carry cells capable of mounting an immune response, and so these transplants have to be closely monitored as well. If this occurs, it's referred to as graft versus host disease. Umbilical cord blood, which contains many stem cells, can be substituted for bone marrow transplantation. Here are some specific diseases related to HLA and HLA typing. Again, this causes an increased risk of occurrence because of the specific HLA. Some inflammatory diseases include multiple sclerosis and rheumatic fever. Endocrine diseases such as Addison's disease and Graves' disease also have an increased risk of occurrence. Diseases such as malignant Hodgkin's disease also has increased of occurrence. Again, the graft versus host disease can result from transplanted bone marrow that contains immunocompetent cells. People that receive transplants require suppression therapy of the immune system, immunosuppression, to prevent rejections to new tissue. Now, there are certain drugs that we can administer that will suppress this cell-mediated immunity. But unfortunately, it does cause significant toxicity in the liver and in the kidneys. Because of this, these drug levels also have to be closely monitored as well. Cyclosporin is the most popular drug and the only drug that I'd like you to be certainly familiar with. Cyclosporin is used in a significant number of transplantations, again because it has such a significant immunosuppressant. Now there are other drugs as well, mycophenolate, sirolimus, but the one I want you to be familiar with is cyclosporin. It's the most popular agent that's used today. Occasionally, individuals may be born with defective immune systems. The congenital immune deficiency, Hodgkin's disease, which is a form of cancer, lowers the cell-mediated immunity. Also, anything that causes compromise to the immune system, such as the removal of the spleen. There are several drugs, cancers, and infection agents that also can cause immune deficiency to occur. Congenital immune deficiencies is just due to a defective or missing gene. You can have selective immunoglobulin A immunodeficiency, severe combined immunodeficiencies, acquired immunodeficiencies developed during an individual's life due to drugs, cancers, and infections. Similar types of immune deficiencies can occur when patients are administered prolonged dosages of prednisone. Prednisone is a powerful anti-inflammatory, though it does suppress the immune system, and sometimes it's used in high doses to suppress the immune system. You get an allergic reaction to contact dermatitis, for example. You touch poison ivy, and your immune system would typically mount a very aggressive inflammatory response for this condition. Individuals are treated acutely with dosages of prednisone, which will temporarily suppress the immune system. There also can be artificial immunodeficiencies. This is the use of immunosuppressant drugs, such as with cyclosporin, and then natural immunodeficiency conditions, such as related to HIV infections. The immune system patrols the body for cancer cells. It's called immunological surveillance. And it's an important concept because individual cancer cells, before they can become established, are recognized as foreign, and they would be destroyed by an effective immune system. Now imagine if we could have our body to mount a immune response to cancer cells. This would significantly impact the treatment of cancers. Cancer cells possess what's referred to as tumor-specific antigens. Cytotoxic C cells recognized and lyse cancer cells. Cancer cells that lack tumor antigens are these cytotoxic T cells would obviously mount the immune system that would destroy cancer cells. A future approach to cancer treatment is immunotherapy, such as the use of monoclonal antibodies with immunotoxins, and we've discussed this previously. There's considerable interest in tumor necrosis factor, interleukin-2, and interferons for establishing cancer therapy. Endotoxins from gram-negative bacteria stimulate the production of tumor necrosis factor by macrophages, and it interferes with the blood supply of the cancer. Herceptin is a monoclonal antibody that's used in the treatment of breast cancer. Treatment of cancer using the immunologic methods, tumor necrosis factor, interleukin, interferon may kill cancer cells. Immunotoxins link poisons with monoclonal antibodies that are directed at the tumor antigen. Vaccines may be used to contain tumor-specific